whatever we want to talk about, we're going to talk about it. What's up, guys? Welcome to another episode of E4 Explicit Podcast. I'm Corey, and this is Antony Davies, a professor, and I will let you kind of tell me your background.
I'm an associate professor of economics at Duquesne University and the Milton Friedman Distinguished Scholar at the Foundation for Economic Education. One of the benefits of Obamacare was this thing that you've described, that if I have a pre-existing condition, I can go in and I can get insurance.
Yeah.
And this is fine. And there are a number of problematic footnotes there, but one interesting thing to ask is, how did we get to the point where this pre-existing condition thing becomes a problem? And we got to this point in part, and it's only in part, but it's a big part, in part because we tied health insurance to jobs. Which is weird because, your employer doesn't provide your car insurance. He doesn't provide your house insurance.
That's
but
true.
He provides your health insurance. And why is that?
Yeah, why?
It's that because back in the 1930s, 1940s, we were having a problem with wages rising, and the government imposed a price limit on wages. And wages cannot rise above a certain point. It was to help control inflation. And what happened? Well, I'm a business owner and I want to hire some guys who are talented, and they've got jobs already. I can't offer them more money because we're already at the cap.
Yeah.
What I can do is offer to pay their health insurance, because that doesn't count as their wages.
What?
And so I say, come work for me. I'm going to pay you the same amount you're getting there, but I'll pay your health insurance also. So what happened was the health insurance became part of the job, because it was how the market got around this wage control that the government had put in place.
What?
And so we have this thing now. Now, of course, we don't have the wage controls anymore, but over time what's happened is that Congress has given special tax treatment to employer-provided health care. You get to pay for it in pre-tax dollars. And because of that, it's cheaper for you and it's cheaper for your employer to provide the health insurance than it would be for you to go out on the open market.
Yeah.
Not because of the market, but because of how Congress has taxed the thing.
What?
So that comes to this pre-existing condition problem. And the pre-existing condition problem in part comes about from the fact that when you change jobs, you have to change insurance because your insurance is tied to your job.
Yeah.
And the new insurance company is going to say, well, you got this pre-existing condition. I'm not going to cover this thing. And now we've got the problem of, how do I get coverage for this problem that I have? And what you see is it's a cascade effect of the government stepping in and, for good intentions, doing something that economically isn't smart. The market reacts. The government reacts to that. The market reacts. And before you know it, you've got a problem, and people are pointing to the market as the source of the problem, when in fact it was the sequence of government interventions that caused the problem in the first place.